Customer data segregation goes beyond storage boundaries. It includes metadata, logs, and backups. Even when application data resides in distinct tables or containers, metadata about activity and usage patterns can inadvertently reveal sensitive details. For instance, error logs might capture tenant identifiers or record counts that could be misused if aggregated. R2 controls encourage careful classification and scrubbing of metadata before central aggregation. Backups must preserve tenant isolation as rigorously as production environments, ensuring that recovery processes never mix data. Providers who can demonstrate end-to-end segregation, covering live, backup, and archival states, show maturity in both architecture and operational governance.
Shared responsibility is the cornerstone of hosted platform assurance. In SaaS models, the provider manages infrastructure and platform security, while customers handle configuration, content, and user management. Clear delineation avoids gaps where neither side monitors a control. For example, the provider may secure storage encryption and patch servers, but the customer must manage who can access exported reports. R2 requires that these boundaries be documented through agreements, service descriptions, and onboarding materials. Mature SaaS organizations deliver responsibility matrices to every client, explaining exactly who owns what. Transparency here builds confidence that protection is coordinated rather than assumed. Identity management in SaaS environments must account for both tenants and administrators. Each tenant maintains its own users, while the provider's administrators require elevated but carefully constrained access. Separation of duties prevents provider staff from viewing or modifying customer data unless explicitly authorized. For instance, support engineers might have masked view privileges during troubleshooting, recorded in audit logs for accountability. Multi-factor authentication and federated identity integrations help align customer and provider access practices. Effective identity models demonstrate the provider's respect for tenant sovereignty while preserving operational flexibility, a central tenet of R2's approach to secure service delivery. Access provisioning and least privilege form the operational backbone of SaaS security. Automating user onboarding and deprovisioning reduces human error and ensures timeliness. Role-based access control limits exposure to only what functions require, from database queries to support dashboards. For example, system administrators might manage infrastructure settings without viewing customer content. R2 encourages evidence of these processes through access review reports and privilege audits. Demonstrating that privileges shrink as responsibilities narrow shows maturity. Least privilege is not simply a policy. It is the measurable outcome of continuous monitoring, automation, and cultural reinforcement of responsible access. Logging per tenant is essential to preserve visibility without compromising privacy. Each customer expects auditability for its own environment, yet providers must also maintain centralized oversight for threat detection and service integrity. This balance requires tiered logging architecture, tenant-specific logs accessible through dashboards, and provider-level aggregation secured for operations and security teams. For instance, a tenant's administrator may review login events, while the provider correlates trends across all tenants to detect systemic anomalies. R2 evaluations look for proof of controlled aggregation and retention. Properly designed logging achieves both transparency for tenants and insight for providers, avoiding blind spots or overexposure. Encryption defaults and key stewardship represent the backbone of trust in hosted environments. All sensitive data, whether in transit, at rest, or in use, should encrypt automatically. Customers should never need to opt in for protection. Key management, however, remains a shared discipline. Providers generate and store encryption keys within secure vaults or hardware modules, rotating them periodically. Customers may manage their own keys through Bring Your Own Key programs when supported. R2 assessors examine key lifecycle documentation, rotation frequency, and separation of duties. Strong encryption defaults communicate that security is embedded, not optional, and key stewardship policies prove that governance extends down to the cryptographic root of the platform. Data residency and localization constraints affect where and how health data is stored. Laws in various countries restrict movement of personal data across borders or require local processing.
SaaS providers must know precisely where data lives and be able to demonstrate control over replication and backup locations. For example, a European client may require its patient data to remain within the European Economic Area, even though the service operates globally. R2 documentation includes mapping of data flows and jurisdictional controls to show compliance. Clear residency governance reassures clients and regulators that global scalability never overrides legal or ethical boundaries. Change management in SaaS must adapt to continuous delivery pipelines. Frequent code deployments introduce risk if not controlled by testing, approval, and rollback mechanisms. Providers must maintain visibility into every release and its potential effect on customer environments. For example, deploying a new analytics module should pass through automated integration tests and documented sign-offs. R2 frameworks expect version tracking, change logs, and communication notices to customers for significant updates. Mature SaaS teams treat change as routine, yet traceable, ensuring that innovation occurs with safety, transparency, and accountability. Incident response across tenant boundaries presents distinctive challenges. A vulnerability or outage may affect one customer, many, or the entire platform. The response plan must identify containment strategies that isolate affected tenants without disrupting unaffected ones. Communication requires sensitivity, alerting impacted customers promptly while maintaining confidentiality for others. For example, an incident affecting one tenant's data should not expose their identity in messages to others. R2 controls mandate evidence of coordinated investigation, notification timelines, and post-incident reviews. Effective response in SaaS contexts proves that speed and discretion can coexist, maintaining trust even during crises. Business Associate Agreements, or BAs, formalize HIPAA obligations between providers and their healthcare clients. They specify roles, safeguards, and breach reporting expectations for handling PHI. SaaS vendors acting as business associates must execute and honor these agreements across all customers in scope. This requires standardized legal templates, tracking systems for expiration dates, and internal awareness training. For instance, confirming that all signed BAs are stored in a central repository accessible to compliance teams ensures visibility. R2 emphasizes the legal operational bridge, proof that privacy promises are binding, enforceable, and auditable. A mature SaaS provider treats BAs as active governance tools, not mere paperwork. Evidence collection in SaaS environments focuses on platform services and automation records. Unlike traditional on-premises setups, providers may not generate screenshots or manual reports. Instead, they rely on configuration exports, automated test results, and system logs. For example, an access review might be verified through an export of user role mappings and approval workflows. R2 auditors look for authenticity, reproducibility, and clear data lineage. Maintaining standardized evidence templates ensures consistency across customer assessments. Automation accelerates both evidence generation and accuracy, demonstrating that compliance scales as efficiently as the technology itself. A scalable, compliant SaaS posture reflects both engineering discipline and ethical stewardship. In health tech, innovation carries an additional responsibility: the well-being of patients whose data drives insight and care coordination. By embedding R2 controls into every stage architecture, access, monitoring, and incident response, providers ensure that growth never compromises governance. Each tenant inherits confidence from the platform's integrity, and each customer relationship strengthens the ecosystem's collective trust. The R2 framework transforms compliance from a defensive exercise into a proactive demonstration of reliability. For health tech and SaaS providers, that balance between speed, scale, and assurance is what defines true maturity in the digital age of healthcare.